Day so far, yeah.
Good, glad to hear it. It's a
We
cool
got
setup. Are you guys on campus at Queens?
yes, we
Got
are.
it.
This is a podcast room in the communications building.
That's very cool.
Yeah, it's amazing. I really like it.
Yeah, it's awesome. We have some awesome tech that's allowing us to flip between cameras so that you can see both of us, which is
It's
really nice.
amazing. Yeah, and the see-through masks, which I'm not sure I've ever seen before. So pretty impressive. Cool.
Yeah, our advisor is hard of hearing, so they help him a lot.
Ah, super. That's great. Very cool. I have a
Yeah.
friend who teaches Latin I live in Charleston. My husband teaches at College of Charleston, and she said that she's used those too when she's teaching for language instruction, which makes sense. It's very cool.
Yeah, that's awesome. Yeah.
Yeah, that's all. I live in Charleston as well, so
Oh, do you really?
that's such a great city, honestly.
Oh, awesome. What part of the city are you from?
Mount Pleasant.
Yeah, great. I live
Yeah.
in West Ashley.
Yeah, we were looking to move there because Mount Pleasant is getting so expensive.
Yeah,
And,
totally.
yeah, but
Much
most
more
of my
affordable
friends,
here.
yeah, honestly, yeah.
Yeah.
Well, welcome back to the Faith and We podcast. Today we have Mary
Ooh,
Ellen. How are you doing today?
I'm great. Thanks so much for inviting me to join. I'm looking forward to this.
Of course, of course. And what is your background at IFYC?
Yeah, so I have been with IFYC for 13 years. I went to undergrad at University of North Carolina in Chapel Hill and did my master's degree at Harvard Divinity School. I worked at UNC for a little bit between that, and then started at IFYC after my graduate program. And I've had a number of different positions across the time of my tenure. My current role is Vice President of Strategic Initiatives. So I oversee programs that are new or that we're incubating for the first time, sort of the experimental stuff that we're trying to figure out.
That's awesome. Wow.
Yeah, it's very fun.
Yeah, I read that you worked with the Obama administration on a project. Can you explain what that was like?
Sure. So around probably 2008, 2009, IFYC's founder and president, who's named Ibu Patel, was named a member of President Obama's inaugural Faith Council, which was an advisory committee for their Office of Faith-Based and Neighborhood Partnership. So he was one of maybe 20, 25 folks that were named to the Faith Council. And the Faith Council worked on a report and a set of recommendations to the Obama administrations for ways to engage religious diversity productively and proactively in civic life. One of the recommendations was to scale interfaith service to 500 colleges and universities across the country. So once the report was made, Ibu and me and a group of colleagues at IFYC helped to advance a proposal for how President Obama could make good on that recommendation of scaling interfaith service to 500 colleges and universities. And that became a program that was launched in 2010 called the President's Interfaith Community Service Campus Challenge, which is quite a mouthful of a name, but it was a really exciting program. We worked with them for 5 or 6 years on that program, helped them sort of develop how it could be an impactful program, how we could reach more and more colleges and universities. We ended up having over 500 campuses involved in the program, engaging in interfaith service activities on their campuses, several million students involved in those activities over the course of the 5 or 6 year program. We hosted, I think, 5 national gatherings in partnership with the Department of Education and other national NGOs that were involved in the program, bringing together several hundred campus leaders, student leaders who were involved in interfaith service activities on their campus. So it was a really meaningful program. It was incredibly inspiring to be able to work with the Obama administration to see a recommendation move to fruition in a way that really impacted people's lives, and to see the long-term effects of the program on higher education and the seriousness with which it takes interfaith service. So it was a very meaningful opportunity for me to professionally to see that kind of impact grow and really spread in the world.
That's so cool. And what led you to want to be a part of interfaith work?
Yeah, absolutely. So I was raised Unitarian Universalist, which is a liberal religious tradition that focuses on spiritual development and social justice in community. I was raised outside Philadelphia in a UU church, so it was a pretty liberal upbringing, a liberal political household and a liberal religious household. And when I went to college at the University of North Carolina, I encountered more conservative religious beliefs for the first time, and I made really powerful friendships with folks who were evangelical and tried to convert me to a different religious perspective. I encountered public religious life, probably in a way that you all have seen going to school in North Carolina as well. You know, folks who would walk around campus sort of preaching the gospel, some in positive ways, others in ways that were challenging to me personally. And I developed these really powerful relationships that made me think about religion differently. I also developed a really close connection with my Unitarian campus ministry. That was something that was really formative for me. My experiences of religious diversity really encouraged me to delve more deeply into my own religious understanding and my own religious community. So when I graduated from Chapel Hill, I knew I wanted to continue studying religion and exploring religion, but I also felt like I wanted to get back to what I thought of as my people. You know, I wanted to get away from the folks that were challenging me and my viewpoints, and folks that I felt like didn't respect my religious identity in the way that I wanted to be respected. So I went to graduate school at Harvard Divinity School, in part because it's a historically UU seminary. So the historical roots of that school are in line with my religious beliefs. So that was meaningful to me and a sort of a call back to what I thought of as my people. And when I got to school, I was in class in the Harvard Law School and the Kennedy School and the Divinity School, of course, and found myself sort of representing conservative religious beliefs often in the classroom. So instead of getting back to the folks that I thought of as my people, I found myself standing up for perspectives that felt underrepresented to me in the classroom because of the relationships that I'd developed on campus, because of the experiences that I'd had in my undergraduate experience. And so I realized that actually I was the one who'd been changed, and I'd been changed by my own personal encounters and my personal friendships that I maintained and do maintain to this day, and still change me and challenge me. And when I graduated, I thought about what I wanted to do, and I felt like there was this deep divide that I'd experienced across my undergraduate and graduate experiences. And there were communities of religious folks in this country that just weren't in conversation with one another, and sometimes we're talking past one another and completely not appreciating the place that they were coming from. So that's what led me to wanting to do interfaith work, and especially within college campuses, because those are the contexts that shaped me and formed me as a person of faith and a person who was committed to doing good work in the world.
That's amazing. I've had a similar experience, except flipped. I grew up in a Methodist church that was pretty conservative, and then came to college and began learning about all of these other beautiful religious identities. And I'm absolutely in love with just exploring them and getting to learn about these different people and the amazing traditions and culture that they have and that they share. So that's amazing. I love that.
Yeah, awesome. That's a great experience. It's amazing how formative relationship building can be in changing and altering your perspective on the world. So that was definitely my experience, and I'm glad to hear that that's true for you too. I think that's true for a lot of folks on college campuses, which is why doing this kind of work in the higher education context is so important.
Absolutely.
Yeah, I agree. College has changed my beliefs so much, and I think that's the main reason of going to college. That's the like biggest benefit for me. I've changed so many like political views, religious views, and
Right.
honestly, it's been amazing. Yeah, I really appreciate it. What is your how does your background in religion affect your viewpoint on vaccines?
Yeah, absolutely. So one of the fundamental tenets of Unitarian Universalism, the first principle, if you will, is the inherent worth and dignity of every person. And so for me, my commitment to not only my own vaccination, but also trying to get as many folks vaccinated as possible across the country is that fundamental idea that every life is valuable, every person is valuable, every life is precious, and that there's a dignity in every human being, and that part of what we can do is to uphold that dignity is to take steps to protect one another. Another principle of Unitarian Universalism is the idea that we're all part of an interconnected web of life. A lot of people will look to that for commitments to climate change justice or environmental justice, and thinking about the broader earth and world and ecosystem that we're all a part of. For me, I really think about that as related to a global pandemic. It's never been more clear to me how interconnected and interdependent we all are, how much our actions affect one another, especially when it comes to public health. And those two ideas together, the inherent worth and dignity of every person and that interconnected web of life, really inspire me to say, getting vaccinated is an ethical step that we have to take to protect our communities. And for me, it's a religious call as well.
That's really cool. So I've heard from our very own Dr. Henderson, Suzanne, that you
Yes,
were,
love Suzanne. Dr. Henderson is the
yes,
best.
she's amazing. And she told us that you worked with the Faith in the Vaccine Initiative.
That's right.
I'm so sorry. Our system just shut down.
That's okay.
So, hello. Give me 1 second here.
Yeah, no problem. Happy to hang.
Oh my goodness.
The whole system is shut down.
Our entire system just shut down.
Oh, that's too bad.
Yeah, interesting. All right, so we're just gonna move to this kind of conversation.
Is that okay?
Yes,
Yeah.
of
You
course.
can, okay.
Yeah, it just all shut down.
Yeah,
Okay.
everything.
Awesome.
We don't know what happened. It's just gone.
Oh no, I'm so sorry. It's still recording, but it's just the video system shut down?
Yeah, our podcast studio, like the roadcaster and everything, just shut down.
Okay.
Technology problems.
Yeah, I know, right? The highs and the lows of technology, right? If you want to reboot it, I'm not in a rush. So if you want to reboot it and try, that's totally fine.
What?
It's totally up to you.
Wait,
She's back on the.
yeah.
Okay, I
think
guess
it's
it's working again. Give us 2 seconds. I'm so sorry.
No problem. No, don't need to apologize.
Technology, man.
Can you hear me?
I can hear you. Yeah, the video is not back on, but I can hear you.
Give us 2 seconds.
No sweat.
OBS also closed because I. There we go.
Boom.
There
Okay.
you go.
That'll be your thing on too.
Oh,
All right. Little break there, 2 minutes.
there we go.
No sweat. These things happen.
Yeah.
All the time.
This thing's crazy. It
I'm
just
back.
shut down. It's crazy. But yeah,
Yeah, that's
like you were
never
saying,
happened.
this pandemic showed us how we really have to come together as a community and really, protect each other. I was always thinking that, like I've been thinking that, imagine if this was like the Ebola virus, and it was deadly.
Yeah.
And way more people were dying, then it would be a real problem. So we should be kind of grateful and thankful that it's not that bad, or like it's not as bad as it could be, and just come together and try to help each other out.
I think about that a lot, about how, both points of what you're saying, that how much worse it could be, and how lucky we are, especially I have 3 kids. And so I think so much about how scared I would be if it were especially more harmful for children. That's been like a real blessing. Obviously, I have a lot of concerns for my parents and folks who are older, who are at higher, folks who are immunocompromised and have higher risks, but there are some blessings to this, to the way that the pandemic has unfolded. And also, I think hopefully there are lessons for us in terms of if something worse ever were to evolve, we're better prepared, and have a sense of what we'd need to do to come together to react to it.
Yeah, I think it's important to see the good sides of this too. Like now, most jobs can be done virtually. We know how we can handle it together as a society, how we can come together as a community, how countries have been sharing so much medical information with each other. We're really seeing the good parts of our society and the bad parts as well. So I think that's important to see.
Yeah, and I personally really appreciated when President Biden came into office, the honoring of all the lives that we've lost. I think there's, it's such a magnitude of death that it's almost hard to wrap your head around. There's so many people who've been personally affected by the pandemic, so many valuable lives that have been lost throughout all of this. I think that moment of national mourning for me was really meaningful. The opportunity to pause and reflect on the magnitude of it all. And at the same time, as you're saying, I think there have been interesting changes in our society as well in terms of how we've learned and grown.
Yeah, I 100% agree with you. Especially like my family, we've had some losses from COVID, and I think that just makes
I'm so sorry to hear that.
It's all good. It just makes you take it honestly more serious, and it makes you strive to like get more people vaccinated, which is, I don't like trying to convince people to get vaccinated. Just show them the information. I think once you show them the real information and like all the myths are gone, like most people are pretty reasonable. But yeah, it's difficult.
I think what I wanted to ask before our little snafu happened is what is your role with the Faith in the Vaccine on the Interfaith Youth Core side?
Yeah, so I have, since its beginning, which is actually just about a year ago today, I've been the program lead for the entire Faith in the Vaccine program. So there's an entire team of incredible colleagues and teammates that I've worked with at IFYC and folks that have been working on campuses across the country like y'all. Just an incredible network of people that have been working on this, and my job has been sort of the lead coordinator internally within IFYC. So developing the program strategy, making sure that our team is set up to be able to implement it, working with fundraising and our CEO and our fundraising team to secure the funding to make sure that we could do all of this work, overseeing how our program was directed. We also have a research partnership with a national research entity, so translating the research findings into our programming implementation. Again, all with an incredible team, but I've sort of had the privilege of being at the center of it.
What are your outlooks in the coming months with the new coronavirus like variant and more vaccine boosters emerging?
Yeah, I'm heartened that there is now a stronger push for boosting everyone. I think that there was some confusion around who should be boosted and who shouldn't, and now it seems much more clear that getting everyone boosted is absolutely a priority. On the new variant, I'm trying really hard to withhold judgment. What is very clear is that at this point, today's December 3rd. We don't have a lot of information. There are some reasons for concern, but nothing concrete that tells us how we should react yet. And so I'm really trying to listen to the scientific advice right now of let's just wait a few weeks until we know more. Let's not overreact to anything that we don't know definitively yet. So I'm trying really hard, even though it can be challenging to maintain that line. I'm trying really hard to stick to that.
Yeah, it's especially scary for me. I might go to Brazil soon, so I'm getting my booster next week. I need to, just be careful with all that because with the new
Absolutely.
laws and
Yeah,
regulations.
especially with international travel. Yeah, absolutely.
Yeah, I don't know. I'm gonna have to get my booster this week, and then hopefully it doesn't get worse. But I think the first U.S. case was confirmed last week or this week.
There actually have been a number now. It's been more and more over the course of the week. So there was one case in California a couple of days ago. Yesterday, they confirmed several in New York and Minnesota as well. So it's actually, as I suspected, when, before those cases were confirmed, I was pretty confident it was already here. And it was just a matter of waiting until it came forward. And this, the fact that we've gotten that many cases so far tells us that it's probably more widespread than we know too. And I think the governor of New York did a really good job yesterday saying that doesn't mean that there's a reason for panic, because we don't know if this variant is actually deadlier, is actually more transmissible. We just don't know yet. So the fact that it's here doesn't tell us anything definitive yet other than that fact.
Just such a complicated problem too, because like imagine yourself as a governor. You don't know what rules to impose to shut down restaurants, like because that's affecting people's livelihoods.
Yeah,
There's just
absolutely.
Big controversy, a big problem for them, and I just feel bad. I'm glad I'm not in that position to make this.
I know. I really do not envy public officials in all of this. It just seems like an impossible job with incomplete information, and the information is changing. The whole line of trust the science is good, but when the science is changing and incomplete, as any scientist will admit that it is, that just makes for a really hard situation to make public health guidance and policy around.
Yeah, I agree. What do you think is the outlook, or I guess your goals with Faith in the Vaccine as we move forward and move dealing with variants, I guess?
Yeah, absolutely. So I think the priorities that are in front of us in terms of vaccination nationally, I think are very clear. Number one, I would say, is getting the unvaccinated vaccinated, which includes children and younger children now. So as I'm sure you both know, being able to get children ages 5 and up their vaccinations. My kids who are, well, 2 of my 3 kids who are eligible now just got their 2nd shot. They were overjoyed. I was overjoyed. It's just a wonderful thing. And I think helping as many parents as possible come to see that this is the right decision for their children and for the larger community is priority number 1. Of course, continuing to talk to Americans who are adults who are unvaccinated, I also think is a priority. Listening with care, having respectful conversations, which is the approach that IFYC utilized in our Faith in the Vaccine program, I think is still a useful technique. But our data is showing that more and more folks who are unvaccinated are actually have no intention of getting vaccinated. I think there are still some persuadable folks, and we should try to get to them, of course, and we should not try to make an already difficult situation even more acrimonious in terms of trying to browbeat folks who are refusers. But I think continuing to try to get unvaccinated adults as much as possible vaccinated is, of course, a priority. And then lastly, getting folks boosted. I think there are a lot of Americans out there who have been unclear about what they should do around boosters. Things are thankfully much more clear now. And for folks who've been involved in vaccine outreach over the course of the year, continuing to now focus on boosters and getting folks boosted, which will help with the new variant as well, I think is a strong priority. So that's what our campus partners who are working on. And one exciting thing, especially for folks in North and South Carolina, is that we have secured funding with wonderful, generous support from the Duke Endowment to continue our work in North and South Carolina with the Faith in the Vaccine program through the summer. So Dr. Henderson is working really hard on galvanizing a new set of campuses, continuing to work with the existing campuses, and really seeing children's vaccines and boosters as the top priority.
Yes, we heard about that, and Dr. Henderson is so excited, and so is Joey, who's one of our advisors as well. They're all so ecstatic. I was going to ask, when your kids were born around this time, they don't really know life outside the pandemic. So how do you feel like it's impacting them?
Yeah, it's such a good question. So I have a 9-year-old, a 6-year-old, and a 4-year-old, and it's you know, the 9-year-old definitely remembers. She knows how much our life has changed, and I think the older 2 especially really struggled with virtual school. So difficult for kids of all ages. I think especially different for young elementary school students who, you know, my 6-year-old was in kindergarten, and having a kindergartner in front of a Zoom screen is a challenge, I can tell you. They miss their friends. We still are not socializing the way that we did pre-pandemic. We do a lot of outdoor stuff with friends who we trust. And I think that's made things easier for them in terms of feeling like they have an outlet and folks to connect with. And they're really grateful to be back in school. You know, life in the South, a lot of schools in the South were really open almost the entire time. And so we've been fortunate enough to have our kids in school last year and in school this year, which a lot of folks in other parts of the country didn't have. And I think that was really a huge factor to change things for them. I had our youngest daughter is 4, and we recently went back to church for the first time, and she didn't remember it at all. And it was just striking to me how so many things that are huge parts of my life and huge parts of how I think about our family's life, she has absolutely no touch point for in terms of the ways that she is navigating the world. So I'm just grateful that we're having these small opportunities to reconnect with our larger community, get back into a groove that feels safe and secure for our family, and just grateful now with our older kids being vaccinated that can continue to expand even while we watch the news for new information.
Yeah. Do you see it ever going away, COVID-19, or do you think it's just going to be like the flu?
Yeah, that's what I hear. I mean, I'm listening to the news in the same way that I'm sure you all are. It sounds like it's going to move now to endemic, so it's just going to be something that's always present and part of our lives. I think 2 things. One, the existing improvement of vaccines will change the way that we have to assess and manage the risk. And then I think new and improved treatments for COVID. There's new treatments that are coming out soon that I think will make the risk even less and will help us all sort of cope with the the mentality and the sort of emotional reality of having something like this out there in the world that we have to contend with. I do think that, you know, there are some folks that I follow, like the economist Emily Oster, who reminds us that for a lot of vaccinated folks, not everyone, of course, but for a lot of people, the risks of deadly disease and hospitalization are actually less than the risks of driving your car in terms of statistical likelihood of serious medical impact. And we don't think about risk getting into the car every day in the same way that I suspect most of us are still thinking about risk around COVID. And so I think part of it is, for me at least, is a mental game of starting to adjust to this is the new normal, and how do we live with this new normal and think about the risks around that. So I think that's a mental process that a lot of us still need to go through, myself included.
Yeah, I totally agree.
Yeah, it's also really interesting to see the difference between each state and how they handle
Oh yeah.
COVID, right? Yeah, like here in North Carolina, we're still wearing masks everywhere inside. We're still doing most things, but then you go to South Carolina, Florida, oh, there's nothing. So it's really, it's a really
That's
interesting to
so
see.
interesting that you notice the difference so strongly between North and South Carolina even. Yeah.
Oh yeah, you go to
Yep.
Walmart in South Carolina, there most people are not wearing a mask. You go here,
Absolutely.
everybody is wearing a mask.
Yeah,
Yeah, that's so interesting.
I also live in South Carolina. I live in Myrtle Beach, and I went home for Thanksgiving, and I wore my mask everywhere, but my family didn't, and nobody else did, and I was like, I don't like this. Just made me uncomfortable. It was scary, I guess.
Yeah,
Yeah, it's really,
totally.
yeah.
I think also, as I've started to travel a little bit more, knowing the vaccination rates of different parts of the country that I'm in can also be really helpful. You know, like I spent some time in DC recently, and they're like 90% vaccinated or something, some very high number that's like completely different from how it is in South Carolina. And somehow knowing that just made me feel like I could do more in terms of dining indoors and meeting indoors and things that I have tended to avoid, just because I knew that around me was a mostly vaccinated population, and as a result, the COVID cases in that area were really, really low. And so I think knowing the data of the area that you're in, both in terms of vaccination rates and in terms of community spread, can also be helpful in making choices about safety. And totally agree with you both that the regional and cultural differences are really striking with all of this.
Yeah, I think keep going.
Okay, I was just gonna say, speaking of cultural differences, I know that you said with your religion that it was kind of a no-brainer, like your duty to be vaccinated, but have you seen any controversy within other people inside your religious identity?
Yeah, that's a great question. I have not heard a lot of controversy around vaccination within the Unitarian Universalist community, so I think probably not. But I do know that other religious communities are grappling with that in different ways. And as I mentioned, we were able to work with a firm called the Public Religion Research Institute, and we partnered with them to do some national surveying on vaccine hesitancy and what factors would encourage folks to get vaccinated. I was really struck to see differences even within racial communities by religious breakdown. So for example, Hispanic Catholics are among the most highly vaccinated community. The Jewish community is actually the most vaccinated religious community in America in the most recent set of polling that we had. White Catholics and Hispanic Catholics are very highly vaccinated, and Protestant Catholics have vaccination levels that are much lower. So I thought that was very interesting that within a racial community, as Pierre, I measured it, the Hispanic community, there was such a strong difference that you could see how religion influenced the way that people think about vaccination within those communities.
Yeah, it's really interesting. If you could give one piece of advice to the world, vaccinated or unvaccinated, what would it be?
You know, I think just it's as simple as the Christian message of love thy neighbor. You know, I think that that's the thing that I would really say to everyone is I think it's especially in a country like the United States that's so focused on individual freedom and personal autonomy, which I think is something that's great about our country. It's a double-edged sword, and I think I've been surprised and disappointed to see the ways that folks make choices that affect other people so dramatically with such little awareness of that. And so I think I would say, love one another, love your neighbor, and treat your neighbor the way that you would treat yourself.
I will snap to that. I love it. Yes.
Thank you so much for
absolutely.
coming on our podcast.
Thank you
Oh, this is so
much.
fun. Yeah, it was so fun. Thanks for having me.
Yeah, we'd love to have you some other time. We're trying to make this an actual thing. So
Cool. I'd be delighted to come back anytime. And if you ever want to talk to other
All right.
IFYC folks too, just give me a
Please
buzz
say
and we'll
it.
figure it out.
Thanks.
Yeah. All right. Awesome.
Yeah, we're so excited. Thank you again for coming and joining us. This has been
Take
amazing.
care. Happy
Thank you
weekend.
so
Hope you have a great one.
You too. Thank you for your time, and I'll send you that thank you gift. Thank you for your
Oh,
address.
that's really nice of you. All right. Talk to y'all soon. Bye.
Thank you. Bye.